Hi everybody, my name is Phoenix Kawamoto. I'm the Community Education Coordinator here at the Town of New Paltz's Office for Community Wellness. I would like to thank you for tuning in for this fourth part of a 7-part series that is highlighting aspects of the Surgeon General's 2023 report entitled Our Epidemic of Loneliness and Isolation. This fourth video, we will be talking more about some of the specific aspects and impacts that loneliness and social isolation have been documented to have on physical, emotional, and cognitive health, as well as some of the extensive research findings that the Surgeon General shares within the report in support of those claims. One of the areas of health that has the strongest evidence showing the link of social isolation to physical health was in the area of heart disease and stroke outcome measurements. Evidence was collected in 16 different independent longitudinal studies that show that social isolation, poor social support, and loneliness were associated with a 29% increase in the risk of heart disease and a 32% increased risk of stroke. Among patients who suffered from heart failure, those that reported high levels of loneliness had a 68% increased risk of hospitalization and a 57% higher risk of emergency room visits compared to patients reporting low levels of loneliness. One of the larger contributing factors to cardiovascular disease is high blood pressure and hypertension. Several studies show that the greater the amount of social support one has, the greater reduction in the possibility of developing high blood pressure, even among members of high-risk groups. It doesn't stop there. When we look at diabetes, something that impacts, millions of people, individuals with diabetes, both type 1 and type 2, who had strong family support had better health outcomes. They also tended to do better self-care, such as taking their medication as directed, were more physically active, adhered to a better diet, and did significantly better at monitoring their blood sugar levels. And in the area of cognitive function and dementia, chronic loneliness and social isolation can increase the risk of developing dementia by approximately 50% in older adults. Just the other day, I was visiting a family member who was transitioning out of ICU to the medical surgical floor. And I happened to arrive right around the same time as the health professional who was there to do the assessment of my family member's cognitive function, short-term memory, to get a sense of the level of resources, what the setup was in their home for when they were going to be leaving the hospital, to see what kind of supports they might need as far as physical therapy, occupational therapy, and also the level of social support. So I'm standing there listening to the questions and hearing my family members' responses, as well as seeing the reaction by the health professional. She was very quick to point out the abundance of support that our family member had, because in the short time that she was there on the floor and aware of our family member, there had been 3 pairs of family members who, were there within that very brief window of time to check on her, to offer support, to see what she needed. When my family reported that they lived alone in their home and then went on to talk about their dog, the medical professional exclaimed, "You don't live alone, you have a dog." And we know, that studies have shown for years the health benefits of having an animal companion, whether it's canine, feline, feathered friends, Having another living being in your home that you are taking care of has a significant health impact in many different ways, decreasing hypertension and blood pressure, sense of companionship, increased in physical activity, especially if you have a dog and then you're walking that dog in the neighborhood. Not only are you getting physical exercise, but you're interacting with your environment, you're interacting with your neighbors, you're having conversation about your dog, and there are all of these added benefits of having animal companionship. I'm not dismissing the very real and serious health challenges that individuals are facing on a daily basis. What we are striving to do is to help point out the different ways that we can take action to reduce some of that impact and help bring some comfort, some care, and some relief to our loved ones and to ourselves. And in doing that, we also can help increase the possibility of recovering more quickly from an acute health crisis. So this is all important food for thought, so to speak. And I thank you for tuning in. Please be sure to click on the link for the accompanying document provided by Diane Fossey here at the Office for Community Wellness. And I thank you in advance for sharing the link for this video among your friends and family. And please stay tuned. Check out the next video as we explore further the Surgeon General's report entitled Our Epidemic of Loneliness and Isolation. Take good care, everybody. Bye-bye.